We are seeing more COVID cases now than at any point during the entire pandemic. And our hospitalizations are nearing the peak of the hospitalizations that we experienced during the Delta portion of this pandemic. Now, we know why this is. Omicron is very contagious, much more contagious than the Delta variant, and it is rapidly overtaking the Delta variant already in the infections in the state of Washington, as well as nationally. We also know that because increasing numbers of people will become ill, we're likely to see some, we hope, temporary disruptions in some of our systems and services in the state. I hope that is not the case, but it's certainly something we've got to be prepared for. So I think in the light of that situation, now is the time to redouble our efforts against this virus. The tools we have used thus far are still effective, thankfully. Wearing a mask, getting vaccinated, and getting boosted, avoiding unnecessary large gatherings inside, particularly where we can. These are things that still work, but on all of those cases, we think we can up our game. We can use more effective masking. We can improve our access to testing. We can get more people boosted, and all of those are things that we can do starting today. That's what we wanted to talk about. So we wanted to just start thinking about, for instance, masking. Given how contagious this new Omicron is, our health professionals believe that it is important to try to use the most effective masks that we can. Now, the mask that is most effective, of course, is the one that we wear. But if we are going to wear a mask, using one that is more effective, perhaps, than just the cotton mask we might have used are things we think can help, which includes KN95 or double masking, particularly using a surgical mask. All of these things can help protect you and your family. Wearing a mask is good. Wearing a better mask is better. And we are hopeful people can consider that in their daily operations. Now, we know our hospitals are already near capacity, and we have serious concerns about our hospitals becoming overwhelmed. So we are asking everyone to take these common sense precautions. We ask that you seek care from your primary care clinic rather than going to hospitals with non-urgent conditions. This will help everybody. And in the face of this variant, we know we're taking several immediate actions to help our communities cope. Let's talk first about expanding testing. Our administration has been working tirelessly to acquire additional rapid tests that can be done at home so that individuals will have better access for a variety of purposes. We have some good news. Our Department of Health has procured and has on very short-term expectations of delivery 5.5 million additional rapid tests to be available to Washingtonians in a variety of ways. We have on hand today 800,000 of these tests. We expect another 2 million by Friday and another 2 million in the following week to be delivered. And those are orders where manufacturers have told us that they will deliver us in those time periods. So we'll have 5.5 million tests available to add to what Washingtonians have of these rapid, convenient at-home tests that will be available. To ensure equitable access, we plan on making these tests available in multiple ways. This is going to include sending 1 million of these additional tests to schools as they request them on top of the ones they already have had access to, both from the state and from the direct purchases. And of course, we've provided billions of dollars, or millions of dollars, to schools for this purpose. So this will be on top of the testing supplies that the schools already have on hand. In addition, we will distribute an additional 1 million tests to local health organizations to be available to communities. Now, to help with distribution of the others, we've partnered with Care Evolution and Amazon to expand our testing infrastructure and create a web portal for families to use that will allow you to go to this portal and directly order these tests for delivery to your home. We will be putting 3.5 million of those tests we've ordered toward that effort. We want to thank particularly Amazon for helping us in the distribution mechanism for this. We hope to have that portal open around the middle of January, and I want to thank everybody for those efforts. This would be on top of the federal portal. So as you know, the federal government will be opening a portal for direct distribution of rapid tests as well. And what we are doing will be an addition to that federal portal. In addition, today the White House advisor Jeff Zients announced that we will be receiving a FEMA testing facility of a high throughput. And I want to thank our federal partners in working through our Department of Health and FEMA to make that a possibility. We don't have the dates for location of that, but we're looking forward to expanding testing capability. And that'll probably be a high throughput one in the hundreds or thousands.